We will now move to our research presentation. Interim Vice President for Research and Innovation, Doug Gage.
Good morning. We are justifiably proud of the research you hear presented at the board meetings, but there are some efforts which exemplify the value of research to the community. Today, you will hear Dr. Debra Furr-Holden present an overview of our community-based public health research in Flint. You are well aware of the pivotal role Dr. Mona Hanna-Attisha played in the early days of the Flint water crisis. You may also know that Dr. Jennifer Johnson, our Faculty Senate President, has a major community-based research program in Flint. As impressive as these individual faculty contributions are, I think you will gain an even greater appreciation of our public health efforts when you look at the collective efforts of our faculty in Flint. Now let me introduce our speaker, Dr. Debra Furr-Holden, Associate Dean for Public Health Integration, C.S. Mott, Endowed Professor of Public Health and Director of the Division of Public Health at Michigan State University. She is also the Director of the Flint Center for Health Equity Solutions, funded by the National Institutes on Minority Health and Health Disparities. She is an epidemiologist by training. Her community-based, action-oriented research has been well received by community stakeholders and driven multiple policy interventions to address some of the nation's greatest public health challenges, especially among racial and ethnic minorities in racially and economically segregated communities. Dr. Furr-Holden attended Johns Hopkins University Krieger School of Arts and Sciences, received a BA in Natural Science and Public Health, and earned her Ph.D. from the Johns Hopkins Bloomberg School of Public Health. She is the developer of a novel observational environmental assessment tool, the Neighborhood Inventory for Environmental Typology. This tool provides a unique systematic means to measure features of the built and social environment linked to violence, alcohol, tobacco, and other drug exposure. In 2005, Dr. Furr-Holden received the Presidential Early Career Award for Scientists and Engineers for her accomplishments in substance abuse research. Debra joined MSU in 2016 and returned to Flint, where she grew up. Along with her research, she is active in the community and currently serves on the board of the Ruth Mott Foundation. Please welcome Dr. Debra Furr-Holden.
Hi, good morning to the board, and thank you, Doug. I'm really excited to share with you all just a little bit about what we do in Flint. I believe it's truly a magical place, so thank you for giving me the opportunity to bring you a little bit into our world. There were some big goals that the MSU College of Human Medicine had when they decided to expand into Flint. The first of those goals was to establish Flint as an education center for advanced degrees. We have this fabulous community med school model. We have 7 campuses all across the state, and they wanted to increase that campus in Flint. We also have a Master's of Public Health program, and I think our goal is also to add other graduate and advanced degrees to Flint. We also wanted to establish Flint's national reputation in community engaged public health research, practice, and translation. And then we also wanted to deeply anchor Flint in the College of Human Medicine vision and our community campus model. And that is one of service to the communities that we raise our hands to serve. We've had tremendous clinical campus expansion that grew out of anchoring this campus in Flint around this community engaged research program. If you look back in 2010, we had about 60 medical students, 3rd and 4th year, doing their clinical rotations in Flint. Now in 2020, we have more than 120 medical students. So our beautiful space is vibrant and alive, not just with researchers, but with budding physicians, many of whom are also engaged in public health research. We moved the Leadership in Medicine for the Underserved program to Flint in July of 2011. And then when we showed up in the Division of Public Health, that program became even more vibrant. And one of our fabulous faculty, Dr. Maika Smart, is now the director of that program, and it's one of the most vibrant in the College of Human Medicine, and those students are some of the most engaged. We also have been able to develop early assurance programs for admission to the College of Human Medicine for well-prepared juniors, really strengthening that pipeline, working with our local partners at Kettering University, the University of Michigan Flint, and now through the tremendous efforts of Dr. Lipscomb and Dr. Liz, we've been able to add Mott Community College and build that pipeline. We are all now present to Operation Warp Speed, the speed at which we're developing a COVID-19 vaccine. And I think this is Operation Warp Speed, the timeline with which we were able to execute this beautiful vision. It's warp speed in that there was a lot of groundwork that was done by many tremendous, amazing leaders at MSU. Our interim dean, Dr. Aaron Sousa, our now director of MSU Extension, Dr. Jeff Dwyer, many amazing MSU leaders did the groundwork. And the initial proposal started in January of 2011. There was lots of community work that happened before that. And our first faculty, the wonderful, bold, courageous Dr. Jennifer Johnson, came as our first faculty in January of 2015, a team of one. And we are now a team of 22 faculty and academic staff and 15 professors. The research program goals that were created were to first attract and retain a core of NIH-funded and acclaimed researchers. We wanted people that had a track record of accomplishment, and we also wanted people with tremendous potential, so very promising early stage investigators who would focus on the community-driven and community-identified areas of research. We wanted community voice at the forefront of our work. A Flint Public Health Research Advisory Committee was established. It had 29 community and university members, and it was more heavily weighted toward community. And then we wanted, and we still maintain, a very participatory process and feedback model. And CHM faculty and staff attended and held more than 100 community meetings and collected data from more than 1,000 Flint area residents. So this is truly a community-informed and community-driven build that we have. And the research imperative was clear. They wanted us to focus on solutions. They didn't want us to simply come in and chronicle and describe the problems and describe what is. They wanted us to help and work collaboratively with them to build and mount solutions. We brought a consultant in June of 2012. They met with that committee, and we decided the first step would be to hire 6 to 7 researchers that would focus on these priority areas that were identified by this collaborative and community-driven committee. So what came out of that, and what is now the major foci of our research? The first is community-based participatory research. Again, they wanted us to focus on solutions. So while we have great epidemiologists who've been at the forefront of much of the work that we are seeing around the nation to turn the tides on COVID, we focus on behavioral health interventions for vulnerable populations specifically. We focus on health equity, the upstream determinants of health, as well as the social and political determinants of health. And then we also focus on policy and translational research and practice. What has been our impact to date? It's been quite amazing. To date, we've generated, when our first faculty started, and I say 6 years, but it's actually been less than 6 years since the actual doors of our community engaged division of public health opened. And in less than 6 years, we've generated more than $72 million in external funding. And about 85% of that comes from the National Institute of Health and the Department of Health and Human Services. We have 15 amazing public health researchers. We have an additional 7 who are also engaged in research in our wonderful Masters of Public Health program. We've created more than 130 full-time jobs in MSU that is and the beneficiaries of that are mostly Flint area residents and local organizations. We collaborate with more than 30 organizations on our externally funded projects. And we have 5 Charles Stewart Mott Endowed professors, including one, Dr. Woody Neighbors, who was the 3rd faculty hired in our program, who retired in 2020. I want to give you just a few highlights of our program so you can get a glimmer of what it looks like on the inside. This is a model that we created. This is published in Progress Community Health Partnerships. This is led by Dr. Kent Key and myself and many others within our division. And I really think it speaks to the heart of who we are as a unit. And we tried to develop for the world a model that would explain, we call it no wrong door. There's no real wrong door to get in on the continuum of community engagement. But what we've learned and what we want to share with others, we say it's about Flint, but it's not just about Flint. Our work is creating a national model that I think others can glean from, and I think other communities can benefit from. So we focus on contextual factors that we know are important for authentically and actively engaging with communities. things like history and trust and relationship building, respect for all of the contributions that all of the partners make at the table, as well as transparency. We also think that what undergirds our work are these very important equity indicators, things like power and control. The typical model is researchers recruit community to participate in work, but we don't work that way. We share in the power and control and the decision making and the resource sharing, and we ensure that there's mutual benefit from our research, both with our partners and the communities that we say we serve. And a real important thing is ownership. We believe that we are not the owners or the keeper of the products or the outcomes of that work, but rather the community is. And so we operate all along this continuum. You'll very rarely find us all the way on the left with no community involvement. We tend to be more on the right, but we've developed real models and rubrics for how other academic units can authentically engage with community. Another thing that we do is we fill policy and translational gaps. We call this the 17-year odyssey. This comes out of the world of dissemination and implementation science. On average, it takes about 17 years for only 14% of research to ever be translated into practice. So you might ask, what happens to the other 86%? Some of it dies in study section, some of it dies in a journal and never makes it anywhere. So our work is about trying to plug up that leaky pipeline and help with the translation. What good is the work if we can't get it translated out into the world? And not only do we believe that research should be translated into practice, but we also know and value tremendously the input of the people who are on the ground floor with their sleeves rolled up doing the work. So we also work to translate what is happening in practice into research so we can develop the evidence base to scale up and scale out things that we know work. One good example of that, a shining program that we have, is the Pediatric Public Health Initiative that's led by Dr. Monahana Atisha and others. We've got a world-class epidemiologist, Nicole Jones, a leading nutritionist, Dr. Amy Sachs-Kustak. The work that they did in Flint with their fruit and vegetable prescription program, literally using food as medicine, caught the attention of our national leaders and was actually included in the US Farm Bill. And now other communities across the country will be the beneficiaries through federal dollars set aside specifically for food as medicine. That model was developed, ratified, and put in evidence-based practice in the city of Flint. We also have engagement at all levels. This is a beautiful graphic drawn by one of the youth in what's called the Flint Youth Justice League. And this is a group of young people who are at the forefront of helping to inform and support the work of the Pediatric Public Health Initiative. One of our core values is we don't do things to people, we don't do things for people, and we don't do things on their behalf without their permission. We do it with them. And since that initiative is focused on youth, youth are also in the driver's seat and they're super creative. I think this is such a great graphic driven and created by one of the youth in the Flint Youth Justice League. We also create pipeline. We're not just training ourselves and working in partnership with community. This is a program that we have called the Health Equity Summer Scholars Program. These are our 2017 through 2019 cohorts. We're trying to build that pipeline of young investigators speaking their interests in medicine and public health and where the two come together, and also giving them the tools that they need to see the world through the lens of equity and social justice. We also do big time support for medical students. This is our R2-D2 training program. No, it's not related to Star Wars. This was founded by Dr. Woody Neighbors. It's the Research to Reduce Disease Disparities program. And this is our current 2020 cohort. When Dr. Neighbors retired, that program is now led by Dr. Maika Smart and Dr. Todd Lucas, and is housed in the Division of Public Health. Again, our goal is to not just have the innovation of our work and our research and our models for how to effectively engage community, live with us, but also to strengthen that pipeline for future scientists. This is a graphic from the Flint Women's Study that's led by Dr. Jennifer Johnson. Not only do we do research that's community engaged, we also allow community the opportunity to help not just inform us, but to inform others about what their real needs are. And Dr. Johnson, who's a clinical psychologist, asked women in Flint, if you could envision anything for this county that would transform the lives of women, what would that be? And then she boldly stands with those partners and has been building a program of research to help to meet those needs. In summary, the college and the university and the community are tremendously proud of the progress that we've made to date on what seemed like insurmountable objectives that would take us a decade or more to achieve. And look at what we've accomplished in just under 6 years. The work has been all consuming, but more than anything, it's been personally rewarding for those who've been involved in the college and across the university. And it's possible because of the partnerships, the public-private partnerships, as well as the partnership with community. So I want to give a special thanks to our hospital partners who support our physical space and help create that pipeline and keep the wind beneath the wings of our program, including Hurley, Genesis, McLaren, the funding from the Charles Stewart Mott Foundation and their staff, an amazing, amazing group of community and community partners, and the many extraordinary leaders at MSU that made the Division of Public Health and our work possible. I couldn't leave without giving you a chance to see who's behind the curtain. These are the amazing faculty and academic staff in the MSU CHM Division of Public Health. Their faces are bright, their goals are big, their hearts are pure, and their will is unshakable. I encourage you all, I don't understand how I could possibly tell you about all of the amazing things that we do in 7 or 8 minutes. So I do encourage you all to check us out. Our website is publichealth.msu.edu. Get some popcorn, you know, a nice cup of tea. You could spend an afternoon just being moved and encouraged and inspired by the tremendous enthusiasm and work that these folks are doing. We also have a pretty strong social media presence on Twitter, Facebook, and LinkedIn. And I also encourage you to look up our faculty. We are also very active in social media. Many of them are on Twitter and Instagram. We're just actively engaged in our community trying to make it better. I'm gonna go back to this slide because it's the one that I love and stop here and give you a chance to ask questions. And thank you so much for the opportunity to share.
Thank you, Dr. Furr-Holden. That was remarkable. Questions from the board. So I'll just make a comment while we're waiting. That's extraordinary. And it really, I think, is a fantastic way to think about our mission and to think about the land grant mission taken to a new level, one that really is based on, as you said, a partnership with the community, service to the community, which is part of the land grant tradition, of course, and our extension tradition, but doing it now in public health and really expanding it to also take advantage of agriculture, nutrition, and so on is amazing. So this kind of encapsulates to me in some way some of the great things we can do at Michigan State University as we think about our strategic plan going forward. I think this shines as a bright beacon to help guide us in the kind of things we're capable of. So thank you. And you're the incredible people on this slide and everybody who's been engaged in this project, because it's a great point of pride for the university. It's really a way in which we're having an impact on people's lives every day. So well done. Well done.
Thank you.
You're welcome. Other comments at all? Okay. Well, thank you so much again.
I was just wanted to say.
Yes.
I just want to say I agree with what all of the things that President Stanley said, but I also wanted to make a comment that when it is safe, again, I would love to come visit and spend some time with all of you and see all of the work that you're doing in person. So when it's safe, count me in.
And we invite and welcome that. And I didn't say this, but we have really beautiful space located right in the heart of downtown Flint. It is a very vibrant, thriving building. You will really enjoy it. I always tell people, come on days that end with T, because then the Flint Farmers Market, which we share a parking lot with, as well as the Hurley Children's Center, is open on Tuesdays and Thursdays and Saturdays. People come to Flint and they find it hard to leave because you get the red carpet welcome, and you, like us, will likely fall in love with our community. So thank you. You are all welcome. Come, come, come.
I love it. Thank you.
I wanted to make a comment as well. I would echo what both of my colleagues said. I think this is incredible work that you all are doing, and I totally agree with you when you indicate that you have to do the work by working with those that live in those communities. And so our mission, seeing it come to life in Flint in the way that you all are working, is incredible. I would also kind of piggyback on my colleague, Trustee Tebay, and saying I would love to come and see this for myself. I was surprised by this presentation. I had no idea that we were doing this work. And so this is just, to me, just fabulous. And I want to commend every beautiful face that I see on the screen for all that you all are doing. We thank you as a university, and I look forward to hopefully meeting them in person one day soon. Thank you.
Yes, thank you.